My name is Monica Schwartz from the School of Medicine, and I am representing Team 12. We invented a clinical medicine educational app called Chief Complaint. My other team members include the people listed here from the School of Medicine, Entertainment Arts and Engineering Department, and School of Medicine faculty. Modern medical education begins with classroom-based teaching that focuses on memorization of discrete facts that are often separated by organ system or teaching topic. There's an abrupt transition from learning these discrete facts to being a member of the care team for patients in later years of training. At this critical point, students struggle to integrate their newly attained knowledge to assessing the whole patient. How can students better translate classroom knowledge to clinical thinking and care? Current options include using differential diagnosis generators, such as WebMD, Isabel, DXplane, and Diagnosis Pro. However, these programs require information from the patient history, hinging on the ability of the provider to ask the appropriate questions. Differential diagnosis generators do not facilitate this inquisitive clinical thinking, since the goal of these programs is to get to the diagnosis. Our app has a different goal. The goal of Chief Complaint is to assist with the step before the differential diagnosis, the process of obtaining the patient information. Chief Complaint is an easy-to-use app that can be used as a study tool or while students are in a clinical setting. Intended users include the students in any healthcare field, medical, nursing, PA, or by employees working in clinics like medical assistants. Here's how the app works. Students can enter in the patient's chief complaint in the search bar. The app will then reveal a list of pertinent clinical questions to ask the patient. Additionally, alongside each question is a brief rationale and reference for why the clinical question should be asked. Chief Complaint is a valuable learning tool for many reasons. In this environment of healthcare reform and focus on decreasing costs through elimination of unnecessary testing, effective clinical thinking is an absolute requirement. Additionally, this app will help train the increasing amount of mid-level providers who will be practicing in the primary care setting. This concept is currently used in some electronic medical records for the input of patient data already. However, these scripts are not comprehensive and not available to the students for educational purposes. Our market includes nearly 500,000 healthcare students in the U.S. across various healthcare fields. We have a renewable and increasing source of consumers with each incoming year of new students and the ability to expand the app to students worldwide. Our team currently has a simple prototype that is a proof of concept for 4 Chief Complaint search options. It has the capability to be expanded by the addition of more Chief Complaints. Our app is easy to use and is compatible with the iPhone and iPad. It can also generate a summary paragraph including the information collected from the patient. In summary, Chief Complaint will help training healthcare professionals more effectively make the transition between classroom-based learning and the practice of clinical medicine, which ultimately improves the quality of patient care. Thank you for your consideration.